So we're going to move across now to the second panel, which focuses on anti-racist practice and how we can really drive that focus in the profession. It's desperately needed. We've been hearing about some of the structural disadvantages and discrimination throughout the morning so far. So this is just focusing down onto the anti-racist practice that we all want to see in the profession. I'm delighted that Cherie Carlton's going to be chairing this next panel. Cherie's a lecturer at Middlesex University, who are Think Ahead's current academic partner, and that whole theme of anti-racist practice is woven through our curriculum. So Cherie is very well placed to chair this next session. So Cherie, I'm going to hand over to you. Thank you so much to you and the panel.
Thank you, Ella. Thank you, everyone. Thanks for the opportunity to chair this panel. It is a privilege. I guess I just wanted to start by saying, you know, the last year has been a real stark reminder following the death of George Floyd, and indeed some of the stark inequalities that we've seen during the course of the pandemic, to kind of continue this discussion about racism and discrimination and oppression in society, but also particularly for us in practice. I think we all have the duty to combat racism and other forms of discrimination, and in all the spaces that they occupy. And I think in social work we have we're in a good position to start facilitating some of those discussions and challenging some of those ideas. I think when we think about that in relation to practice in the UK over the last 10 years, Black people have accounted for 8% of those who have died in police custody, while accounting for only 3% of the UK population as a whole. And they're more up to 4 times more likely to be detained under the Mental Health Act in relation to white counterparts. I think we can extend that also to other areas of social work practice, thinking about the prevalence and incidence of disproportionate numbers of black children in the care system. I'm by no means an expert either personally or professionally, but I am committed to facilitating discussions and keeping conversations going about how we can promote anti-racist and anti-discriminatory practice. With this context in mind, I think, you know, we've worked really hard in our current curriculum to look specifically at racism and discrimination, and look at incorporating diversity and difference. And so we've really been kind of encouraging our participants to engage in discussions around curriculum content in this area. We are committed to making change in that area. Rather than listening to me waffle on for any extended period of time, I will hand over to our panelists, who will give us some of their ideas and views about how we could work more actively to achieve anti-racist practice in social work, drawing from their own experiences. I'm going to start by introducing LaReo Riviere, who is an advanced mental health practitioner with quite an extensive 20-year experience of delivering and managing frontline mental health services. He has completed postgraduate training in social sciences and has retained an academic interest in the intersection of race, culture and mental health over the course of his career. He's been a regular contributor to Bournemouth University, London and BIA programme, and has been a teaching consultant on Goldsmith College Social Work Department. He's also an independent trainer, so I'll invite him to draw on his experiences for the conference. LaReo, over to you.
Thank you, Cherie. In terms of addressing the question, how should social work continue responding to the Black Lives Matters movement? I think it's quite topical and an opportune time, really, to be thinking and to be thinking again about these issues, because I think what we've noticed since last year is there seems to be almost, if we look in the popular press, an attempt to sort of demonize or delegitimize, you know, the idea of the Black Lives Matter movement. And it's just a reminder. I think we need to be reminded that clearly You know, that movement started after the death of Trayvon Martin in 2013, but of course it became more prominent last year after the death of George Floyd. But if we go much further back, of course, you know, the issue of race and racism, the issue of white body supremacy has unfortunately dogged, you know, the Western world, the world in general, for a very long time. And social work, I think, is very privileged to stand in that gap, to be asking the questions about how we respond. I think um, when we think in terms of our profession, in terms of our values, we think in terms of our commitments to things like equality. We think in terms of our commitments to social justice. I mean, these are hardwired into our profession. And so, in terms of saying, well, how do we respond? I think one of the first things we do is just to remember that, in a way, we don't have a choice as social workers. You know, responding and being anti-racist and trying to address social inequities is something that is endemic in what we do. This is our bread and butter. And I think in terms of, you know, I think there is also, in my view, a sort of, we're in the midst of, I would argue, a sort of culture war with different views of what society should look like. And I think as social workers in practice, we have to take a stand in terms of where we are in that culture war. And of course, the culture will involve things like, what is the nature of the state? What is the role of, you know, how do we deal with difference? We cannot we cannot afford not to be political, is my argument. We have to be political about our social work. A social work that is depoliticized is not social work. Social work, it's, you know, you cannot be, in my view, a social worker and not be an activist. It's a they don't, you know, they don't add up. We have to be activists, you know, and when you sign up to be a social worker, I think you have to continue to be an activist. Now, of course, I started, you know, thinking about race and mental health and culture and you know, more deeply in 2008. And I think what was clear then, it was like, you know, I felt I was kind of pushing against the grain, because clearly then we had Obama being elected in, you know, the president of America, and there was this view that race no longer mattered, and so on and so forth. And, you know, we had entered a sort of nirvana in terms of race, and, you know, anti-racist practices wasn't necessarily important anymore. But clearly we've seen, you know, and, you know, we've seen of recent how, you know, we've seen the very stubborn sort of statistics in terms of just how Black people are sort of socially disadvantaged. And we've seen even more with COVID. We've seen how, in my own anecdotal, you know, evidence is that I've had, sadly, two Black female colleagues who've died this year, a few weeks ago, from COVID. We've seen how those sort of entrenched inequalities have kind of been sort of highlighted by you know, this COVID pandemic. So in terms of how should we respond? I think, one, we should respond by recognizing that, you know, we have to take a stand. We have to be on the side of, you know, of recognizing that social inequity, social injustice is something that we have to push back against. In terms of our practice, we have to recognize that racism is it's a reality that for lots of people in our society, and the impact of racism. We have to see racism as trauma-inducing, and I think Ruth mentioned earlier of trauma in informed care. I think that, you know, organizations, practitioners, we have to come to the idea of practice, a trauma-informed practice, recognizing that for a lot of our service users who are Black and minority ethnic, you know, they would have experienced trauma, and we know the impact of trauma. We know the sort of powerlessness that people, you know, experience. We also know in terms of, not only in terms of the impact on on service users, but on social workers ourselves. You know, it's Black and minority active social workers who experience racism in their lives, and services and organizations need to think about how we address that. I think we also need to have an idea, a think again at power, and just what it is and how it is used. And as social workers, we've got to become more comfortable with addressing power and using power in a way that is going back to the sort of probably 1970s, 1980s, you know, ideas of the sort of anti-oppressive, you know, using power to really empower people, to work with people, co-production, to see service users as our fellow citizens, and to recognize that, you know, we have, as I said before, a unique opportunity to really address some of those issues, to think in terms of things like vicarious trauma. I think also to think, I think as in terms of practice, to think in terms of self-care for ourselves, and to also think in terms of recognizing that, you know, there are, as I said, sort of use disadvantages, and these are sort of, they obviously, in terms of particularly mental health, we know the social antecedents of mental ill health, and we know one of some of the oldest sort of sociological research is that poverty, it's you know, it's something that we've stopped talking about, and I think we need to start talking about poverty again, because clearly we could see the impact on poverty in terms of how people experience, you know, how it is shown up in people's mental ill health. So in sort of summary, I think, you know, going forward, we need to recognize that racism is not inert. We need to call it for what it is. We need to move away from this idea that we seems to have racism but no racist. And it's this sort of almost dystopian idea that nobody wants to be called a racist, but we say racism exists. And of course, you know, there is racism, and of course they're racist, and we have to recognize that we've got to build and strengthen and work with allies, and to ensure that we provide opportunities for people to thrive and grow, and we shouldn't, as I said, we should be very, very cautious about you know, moving in a direction that almost seems to depoliticize social work. And I think that is really my view about how we keep the momentum of Black Lives Matters going, and how we recognize that, you know, we are unique as a profession for having the tools, for having embedded in our values ideas about really addressing social inequities. Thank you.
Thank you, LaReo. That was really good. It was really interesting to think about some of those those themes like power and privilege, and you know how core anti-racist practice is to social work values. Thank you for that. I would encourage attendees, delegates, to utilize the chat in anticipation for the Q&A session. Drawing from some of those themes that LaReo brought up around trauma and trauma-informed positions, I would like to introduce you to our second panel member, Dr. Karen Linde. Karen has a strong commitment to research near practice, especially in the area of trauma-informed and collaborative practice. She leads the Social Work for Better Mental Health Improvement Programme, which is supporting the transformation of services towards more socially informed and social justice approaches. She's a member of the new National Social Care Workforce Race Equality Standards team, leading on workforce equality standards for social care, looking specifically at the lack of diversity of adult social care leadership in local authorities and within the Adult Principal Social Work Network, including 18 local authorities to sign up to this. And I think many of them are partners, will be partners with Think Ahead. Dr. Karen Linde, can I hand over to you?
Great, thank you. Yes, I'm going to probably talk a bit about the interface really between organisations and practice. I'm, as has been discussed already, I'm really passionate about trauma-informed practice, so I'll probably come to that after the discussion about the organisational side of things. So just a bit of context. About 4 years ago, myself and Roger Klein undertook a piece of scoping work about the workforce race equality standard and its relevance to social care and social work. And we did a lot of discussion really with social workers at the front line, talking about their experiences of organisational culture, and we're somewhat shocked about the sense in which people felt when it comes to issues around racism, they were on their own, so that they didn't really understand or didn't have a sense that the organisation itself was able or competent about raising those issues, either at management or leadership level. And also that there wasn't any real symbols or rituals that declared what the organisation's position was, or how to support staff that might be interacting around an experience of a microaggression or any of those incidences that routinely happen in organisations. So it was very common for, we talked to HR as well, so HR often thought that issues around, the microaggressions around racism happen rarely, and that they, that you can use policies to address those, and it was perceived as quite a manageable issue, if albeit hidden in the organisation. So I suppose another theme that came out was the difficulties. We spoke a lot to Black social workers who also talked about the culture within social work and in organisations around the kind of presumption that social work itself was free from racism, and that it was actually sometimes really difficult in a context where there was a presumption that social work itself upheld rights, values, and was able to practice those things routinely. It was actually quite difficult for Black staff to raise that as an issue within the profession. And I think that's significantly changed over the last 2 years. But at the time, it was there were no mechanisms really for that dialogue to happen. So that piece of work, which basically argued that we needed a much stronger organisational framework, not only for the data, and other people have been mentioning the systemic nature of this, but we, maybe shockingly, we do not have a data set or any clear expectations about the common standards for how workforce race equality is discussed, and the report recommended that. But it was paused for about 2 or 3 years, and then fortunately was taken up by Mark Harvey and the Chief Social Worker's Office, and Nimel Jude, who's also within that setting. And what we've seen over the last year is huge traction around the piece of work. So it's an encouraging story really in the end about the progress around this framework. What we have now is a commitment from the chief social workers and a whole network of people who are supporting the work to implement the workforce race equality standard in social care. So myself and the amazing team that I'm part of, with Nimel and representation across all different parts of social work, including children's social care, that team is now testing, talking to social workers and others around their views on what the metrics need to be, although we do have quite a prescribed view about those, which I'll talk to you about in a minute. But that, I suppose the point that I wanted to underline really is it's really hard as practitioners to progress practice, however passionate you are, if your organisation isn't legitimating your work and isn't actually declaring its own position around racism. So I think it's really important that we also, the profession itself also pushes its organisations to engage with principles and policy that are appropriate, and that it has an expectations that, that organisations will support that practice, that you don't do it alone, that there's a sort of dialogue with your leaders and your top teams around the implementation of that work. So just to give you a sense about what the res is, it's 9 metrics. We spent a huge amount of time consulting with people, and it addresses disparities and experiences between black and white staff and experiences that are very evidence-based. So as many of you know, we have a huge amount of evidence about the gaps in experiences, particularly around progression into senior roles, around the experiences of access to CPD and stretch opportunities, around the experiences of discrimination, harassment, and overrepresentation in disciplinaries and also in fitness to practice. So all of those dimensions are part of the res, and we are now testing those 9 metrics with 18 organisations, and I think really the culture in many ways, completely due to Black Lives Matter, has completely changed. I think, you know, what was impossible 4 years ago, I think there is definitely a shift in the culture towards people being more prepared organisationally to be open about the difficulties, and also to, you know, to be vulnerable and declare the systemic nature of racism. So it actually does feel like a very different culture to me that we're operating in. How much that will be sustained, we have to sustain that, and we also have to push forward on it. But I think it's really important that people know this piece of work is coming up. So my hopes for it around social work is that social workers will know that their organisations have a set of principles. They will be reporting on metrics to do with race and race equality on a regular basis, and they will have to showcase what actions they're taking around those metrics in a regular way. So it's a huge shift in the culture around, you know, what your organisation is doing not being visible or not being known, or policies being hidden or not talked about. And I just wanted really to let people know that that's coming on stream, and also, although it's starting off at the moment in the first phase, it will come out to all organisations. And I think it's really struck me, I've also, as many people here know, been doing lots of work around the social work role, and one of the strong findings is just the power of organisations to repress abilities and capabilities. So one of the common findings was social workers really wanted to be anti-racist, but they didn't feel that they could use those capabilities as part of their routine practice. So I think we really have to work as hard on practice as we do on organisational culture, because both of those things need to change. And just finally, just on the theme of trauma-informed practice, I think organisational approaches to trauma-informed practice completely intersect with this. So another piece of work that is coming on stream, which I hope will be helpful, is a skills and trauma-informed framework around trauma-informed practice, which Health Education England and Skills for Care are developing at the moment. And that has almost completely been informed by interviews and perspectives of social work. So it's very socially orientated, and one of the kind of core streams that's come from that is that social workers do trauma work at the moment, but organisationally are unseen. So I think there's a huge issue about making visible trauma practice, and also the recognition of the breadth of trauma work. So racism is a form of trauma, and we don't talk about it like that. So I think there's significant cultural changes happening that we need to work together, as you know, within the whole field of support around practice, to kind of embed and move forward.
Thank you, Karen. I think you raise some really interesting points around, you know, linking the historical traumas that people have experienced and current traumas that people experience, and that also the kind of links with intergenerational transmissions of trauma, and that being recognised within this context, but also quite inspiring to think that we're seeing some traction, we're seeing some opportunity for change, and that we've got a really good opportunity to kind of move with that and to kind of continue to drive that forward, kind of linking you know, that with practice and pushing that ahead. So I feel quite inspired by that work. So thank you. Again, I will ask that delegates continue to populate questions. We will run into a question and answer session at the end. But before we do that, thank you, Karen. I would like to introduce our third panel member, which is Renée Aleong. Renée's gained extensive experience working within the Ministry of Justice and Nursing and Midwifery Council prior to undertaking her BA in Social Work and MA in Social Research at the University of York. She's now in her second year of her council scholarship. She's currently undertaking her PhD research in institutional ethnography, looking at disproportionate detention rates in BME people in relation to working culture and practices of AMHPs. She's looking at talking to us about the wider social context in which AMHPs are working and the systemic social issues which result in people presenting in crisis. She's passionate about research driving change in social work, so that's wonderful to hear. And she wants to inspire others to provide a stronger evidence base for social work practice. She also has a blog entry on Black mental health matter. Handing over to you, Renée.
Thanks a lot, Shan. Good morning to the wider viewing audience. I'm just here to talk about my research a bit and how it sort of adds to what Karen and LaReo said before, and how we can address anti-racism in social work. And I'll just start off by saying that many have argued that racial stereotyping of Black people, racism, cultural ignorance, and stigma associated with mental illness, when experienced together, may undermine the way in which mental health professionals, such as social workers, respond to and assess the needs of Black service users. In addition to that, the coercive pathways to mental health services experienced by Black service users are often directly linked to this disproportionality and the higher rates of compulsory detention under the Mental Health Act. However, there are also alternative views, including stigmatized attitudes towards help seeking within Black communities, differing cultural health beliefs about mental health, and assumptions about wider drug use amongst minority ethnic groups that also suggest that mental health inequalities are likely to have complex issues. And how my research comes in is little is known about the impact of institutional factors. I know Karen just mentioned she's looking at actual mental health professionals and social workers within their institution. But my research is also looking at the impact of institutional factors such as organizational and professional culture and practices within adult mental health services. As a social worker and a social researcher, these issues are of central importance to me, and I'm sure to most of the professionals that are viewing. And I hope to address this gap in knowledge through my PhD research by examining whether operational and institutional structures within the role of social worker, AMHPs and social and mental health social workers influence the process of compulsory detention of Black service users under the Mental Health Act. And in order to look at that, I had to look at the role of mental health social workers and in particular AMHPs. And I thought areas of practice with marginalized populations should require social work to consider its role in the process that leads to the involuntary detention of Black service users under the Mental Health Act. There are an estimated 3,900 AMHPs in England, of which 94% are social workers. So an important element of the role of the approved mental health professional is deciding after all circumstances of a case are considered that compulsory detention in a psychiatric hospital, also we know it as sectioning, is the most appropriate way of providing care and medical treatment to meet the needs of a person. So it can be argued that as social workers, as AMHPs, we are directly involved in processes which lead to this disproportionate detention of Black service users as they make the final decision as to whether someone should be detained or not. Conducting Mental Health Act assessments is one of many elements of the role of mental health social workers and AMHPs. And I acknowledge that AMHPs alone are not able to resolve the myriad of issues that contribute to ethnic inequalities in mental health. However, I think as social workers, as mental health social workers, in particular, AMHPs are able to play a significant role in this process. And crucially, mental health professionals, such as AMHPs and social workers like myself, bridge the gap between policy implementation and practice. That's why we have discussions like we're having today. And we could shed light on why previous attempts to tackle ethnic inequalities through race equality training and policies to support equality in Black and minority ethnic mental health have had little, if any, impact on closing Britain's ethnic health gap. I know Cherie mentioned some of the statistics briefly in her introduction, but I will, just for sake of knowledge, for those who may not be familiar with some of our mental health statistics, I think fundamental to tackling issues of inequality is an understanding of the scale and nature of ethnic disparities within our mental health system. The latest national mental health statistics show that Black people with mental illness have higher compulsory admission rates to hospital and are 4 times more likely to be detained under the Mental Health Act compared to white people. Black men are also more likely to have police involvement in their admissions, higher rates of transfer to medium and high security facilities, and receive secure care in a locked psychiatric ward. Black men are also more likely to be diagnosed with schizophrenia, 3.1% compared to 0.3% of white men. They're also given higher doses of medication and are less likely to receive talk therapy, psychotherapy. Additionally, when compared to white people, Black people are 8 times more likely to be subjected to supervised treatment with conditions once discharged from hospitals. That could include where they live. And again, as Cherie mentioned, despite making up 3% of the general population, people from Black ethnic groups have both the highest rate of detention and detained people subject to repeat detention. 19% are re-detained amongst all broad ethnic groups across England and Wales. So this differential treatment of Black people coming into contact with mental health services has been well documented over the last 3 decades. It's been 20 years since the Macpherson report. Likewise, monitoring bodies such as the Care Quality Commission have highlighted these inequalities, and high-profile reports as Stephen Lawrence inquiry, as I said, the Macpherson report, the David Bennett inquiry, they have all acknowledged the prevalence of institutional racism experienced by Black people. And even as LaReo said, within the current pandemic, these ethnic inequalities of COVID-19 are clear, as it disproportionately devastates ethnic minority groups in Britain, from the severity of infection to the scale and loss of life. So if anything, I think these statistics show that despite efforts of successive governments to tackle these inequality through numerous commission reports, policies, initiatives, and training, there has been little impact on narrowing Britain's ethnic health gap. Furthermore, I think we should have discussions about the widespread use of acronyms like BME and BAME in mental health policy, research, and practice. I think it's problematic as a researcher. I'm struggling to, with which terms to use, to really zero in on the issues. So decades of a one-size-fits-all approach to ethnic mental health, I think, has led in the past to blanket policy and practice responses that do not take diverse and specific needs of minority communities into account. So the question for me as a researcher still remains, and as social workers, it still remains, how do we address these issues? And more importantly, how do we get to the root cause of this long-standing systemic inequalities? I think by examining the sources and outcomes of overrepresentation rates, we may better understand what drives inequalities in mental health services, including how inequalities enter the mental health system. And it's this area that I'm exploring through my research. So I'll tell you a bit about what my research, the aims of my current PhD research is. So building on my previous research findings, my current PhD research will use institutional ethnography as a qualitative method of inquiry to answer the guiding research question: how do the operational and institutional structures within the role of the social worker approved mental health professional influence the process of compulsory detention of Black service users under the Mental Health Act? So institutional ethnography, that method that I'm using, is premised on accomplishing social change for disadvantaged groups by revealing anomalies between institutional policies and actual practice. So I will be looking at all the policies that drive AMP work and then observing what actually goes on the ground in terms of, do we have the correct resources, if policy matches practice, basically. And I think by making use of this innovative research method, I hope to describe the ways in which the role of social worker, AMHPs and social workers conducting sectioning processes under the Mental Health Act is structured and operationalized. I will examine the challenges this poses on social workers' ability to provide independent decisions, seeking the least restrictive alternative and bringing that social perspective to bear in their decision. I know this is not always, as easy as we say. My study will focus on the impact of Black service users as specific and significant disparities in rates of mental illness, detention, treatment, and outcomes for this group persists. So I'll be looking specifically at Black service users. I will be adopting institutional ethnography's common methods of data collection, which will include observing, well, it will be hard to observe, but we'll see how the pandemic goes in terms of me having actual interaction with approved mental health professionals. I will examine written policies and procedures in order to learn how things work, and as well as my own reflections, because although I'm a social worker, I'm not an approved mental health professional. So I'll be outside looking in. So my own reflections will come in handy there. And these methods will be used to demonstrate how the work of social worker is systematically coordinated through a complex conversion of national and local policies and procedures. So that's what I'm doing in a nutshell. And it's the first institutional ethnography of its kind in the UK. So hopefully I'll be back, on this forum to share with you some of my findings. And I'm really excited about this piece of research. Thank you.
Thank you, Renée. Thank you so much for your passion and your commitment to addressing the systemic issues and how they translate on the ground. We really do look forward to your findings in due course. I'm quite excited to hear how that progresses. I'm going to move us on to our final panelist, Jacqui Bao. Jacqui has over 25 years experience of social work and as a frontline social work practitioner and a senior manager in a multidisciplinary mental health service. She's trained as an AMHP practice educator and worked with a range of adults over the course of her career who have complex mental health needs. She's going to bring her perspective of frontline practice and practice education, and will be drawing on embedding anti-racist practice within the programme and framing discussions in consultation with the curriculum and linking this with professional leadership. Jacqui, over to you.
Hi, thank you, Cherie. And I did drop off this call earlier and I managed to get back in. So thank you, Sean. I'm going to start with a quote, actually, and it's a quote from Wayne Reed, who is BASWA's England professional officer in social work and anti-racism visionary. And Wayne says, those of us who are confident and capable enough with the right support can have a crucial role in educating, empowering, and equipping ourselves and potential allies and influencers to enhance and shape anti-racism initiatives in our workplace settings. So first of all, I want to talk a little bit about racism. Obviously is a word that we tend to shy away from. And actually, I want to sort of first of all say there isn't and shouldn't be a debate about racism's existence. We should acknowledge racism's presence. And the presence of racism, we know, is in organisations. It has been for a long time. We've talked about already the Macpherson report and institutional racism. I'm not going to centre my whole conversation around that. I want to talk about obviously been a social worker for over 25 years, but to talk about perspectives in terms of my personal, professional and organisational context. First of all, I want to say that I'm really proud to be working at Think Ahead, and it was great for Ella to remind us that we're about to train our 600th social worker. And if I've been involved in every one of those social workers training, I'm really proud of that. And I'm really proud to occupy a space that I don't think I've ever in my career been able to occupy, to talk about things that are really, really important to me. I also want to sort of talk a little bit about language. Over the last year, actually, words like woke, unconscious bias, microaggressions, BAME, have kind of entered our our psyche. And actually, I think sometimes that some of these words and phrases, particularly sort of unconscious bias and microaggressions, is sometimes a way of us not actually talking about anti-racism. In some ways, it makes the language of racism more palatable for people to discuss, because actually if we challenge people and talk about racism, it can be sort of quite an affront, and people not necessarily understanding what racism feels like. I am somebody who has lived experience of racism. Moving on to my professional background as a social worker, not only did I see people that used mental health services experience racism, but also seeing staff experience racism. And one of the things that I think in terms of how we achieve anti-racist practice in mental health social work is listening to people's experiences, people that we work with, people that work within organisations. It's quite interesting, the word service user. I am a service user. I use a GP surgery. I use my local community shops and facilities. So I use services in a way that also have long-standing thoughts and stereotypes of people, Black people. Renée talked earlier about the use of the term BAME. Again, that's something that I wouldn't necessarily describe myself as, and service users wouldn't necessarily describe themselves as. So when we're working with people that use services, we need to listen to them. We need to listen to how they want to be described. We need to adopt different approaches so that we can have a professional curiosity. And professional curiosity is about asking questions and not feeling that we're going to offend people within our social work practice. One of the things that we also talk quite a lot about in terms of social approaches in mental health and working with Black people is relationship-based practice. If we don't know the people that we're working with, and how are we going to understand their experiences and their lived experiences quite often, which is every day. We've talked earlier about trauma and how some of those traumatic experiences can be relived and be triggered. George Floyd's death triggered a lot of people in the last year in terms of their experiences of not only in mental health services, but their experiences when they step out into the community. So I was saying that certainly my personal experiences and my professional experiences are closely aligned. From an organisational point of view, I wanted to just make sure that people are aware of what Think Ahead are doing as an organisation in terms of their equality, diversity and inclusion strategy. We want to make sure that we recruit enough people into the profession that are from a diverse background. We want to ensure that our curriculum that we deliver with our academic partner, Middlesex University, it's a curriculum where we have looked at whether or not there are areas to decolonise and internationalise. We also want to make sure that we improve the experience of trainee social workers that come onto the Think Ahead programme when we ask them how we are doing as an organisation. We also want to make sure that our staff in our organisation are reflective of the people that we are wanting to also recruit in terms of a diverse space, and also the people that use services. And lastly, because I've been cued that I have only about 30 seconds left, that I want to make sure that we continue to listen, to review and to learn. And I'm really proud to be working with our alumni from Think Ahead from 2016 onwards, who are continuing to tell us their experiences and teach us about where things where we can make and continue to make improvements on our programme. Thank you.
Thank you, Jacqui. I've been keeping an eye on the Q&A, and there are a number of questions. So Jacqui, don't go anywhere just yet. Thank you so much for your contributions. There's obviously a number of questions that have come up in the Q&A. So I'll pose one. One point was racism as a constant. And the topic itself is always prevalent. To what extent do you think that the responsibility of an individual social worker to stay up to date with issues related to racism and minority backgrounds? Is it up to the social worker, or should their workplace be responsible for keeping all social workers up to date on current issues, and how to support service users in relation to those issues? I might go to LaReo, if I might, for that response in the first instance. No? Perhaps he's
So,
oh yeah, you're
no,
there.
I'm sorry, I was on mute. I think I would go in terms of responding. I think clearly the onus is on the individual social worker in the first place, because primarily, if we look at the sort of social work England's sort of standard 1.5 to be exact, you know, there is an expectation that we recognize the differences across groups and try to readdress these where we can. And if you're an AMP, as I am, you know, you look at the competency framework, there's also an expectation as well that, you know, we address social inequalities. So I think, yes, I would agree that services, organizations should create the framework, the culture where it's easier to do. But as an activist, I think, because one of the points I want to sort of emphasize today is that social workers are activists. And as an activist, often you're working in organizations that do not necessarily share or support your views about where you think society should be, even if it's there in terms of the black and white, but in terms of practice. So I would really encourage every social worker to think to get on top of, you know, to keep themselves updated with the knowledge, with the values, around race, around inequality, just like how you would if you were, you know, you would keep yourself updated on issues around assessments. You know, you wouldn't necessarily say, well, you know, it's the organization's responsibility to provide me with every, you know, new piece of information around the way that I conduct assessment. You know, there is a responsibility, I think, for the individual worker to think in terms of, you know, how do I get that knowledge? How do I skill up? How do I keep up to date? I mean, I note in one of the other questions, I note that one of the in the chat, somebody commented that, well, you know, are we sort of singling out racism? And I'm not here saying at all that racism is the reason for every element of social inequity. But of course, the focus of today is to look. There's a constant. Race is a constant. Race matters. And, you know, Renée talked about the very, very stubborn, you know, statistics around, you know, the experience of black people in the services. I don't think as a profession we could sit back and not really address this. I would say, yes, of course, there may be other approaches, and, you know, I'm not here dismissing probably there are, I'm sure, probably non-progressive ways of addressing some of these issues. But I just, as a social worker, I think that, you know, the progressive framework of seeing poverty, of seeing, you know, social injustice as a common factor is something that we have to recognize. And I would encourage social workers to keep learning, keep moving, keep growing, so that we could bring about change in the life of our service users, not only because they are service users, although no matter how problematic that term is, but I also want to say, but more so because they are fellow citizens and we share a common citizenship.
Thank you. Thank you. Whilst I accept that that was one answer, and thank you, LaReo, for that, I think that was really helpful. Hopefully, if other panel members have other ideas, they might want to take that up later. But I'll move on to another question just so that we can try and get through the number of questions that we've got. We've only got 5 minutes. How do we assess social work training, the capabilities which are prerequisites for anti-racist practice? What needs to be evidenced and reflected on in developing anti-racist practice? Do we need explicit prescribed curricula, which is universally shared, inspected and audited? What should this new learning seek to measure for Black, Asian, minority, ethnic and white social workers in training? I'm going to put that to Jacqui, if that's okay. Jacqui.
Well, that's a big question, and very little time to answer that. I'll pick up on some of the things LaReo was saying about I guess the professional capabilities framework and who we are when we come to work, who we are when we join training. And for me, it's a conversation about values, our behaviour, our beliefs, our attitudes. And yes, whilst we can have a framework that is, I'm not going to say it's ticking boxes. Of course, we have to tick boxes, but we really have to turn some of those conversations in on ourselves. Why are we here? Who are we? Who are we? You know, what is our mission? Who are we working with? What is our purpose? What do we hope to achieve? What do we hope to change? I trained as a social worker in 1993, and I sometimes say, I cannot believe I'm still talking about this, but I have to still talk about it. I talked earlier about acknowledging its presence. It's still there. I know it's a big question. I wanted to ask, just there was a bit of the question at the beginning I didn't hear. Sort of, could you just repeat a little bit of the beginning of that question, Cherie?
How do we assess in social work training the capabilities which are prerequisites for anti-racist practice, and what needs to be evidenced and reflected on?
Okay, and I think I talked about values. Values is something I think that, unfortunately, I think I've seen the dearth of teaching of values on social work courses. We talk about them, we have definitions of them, we know what they are, but I think we need to have some more probing in terms of attitudes, beliefs, behaviours, tone, understanding. That can be assessed. It's something that I've written about, but it's something I've written about. It is something that can be assessed. And I think that through our navigators on our Think Ahead programme, our consultant social workers, and hello to some of the consultant social workers that are here, they are the people that are assessing our Think Ahead trainees on the ground. And they are the people that are observing them in practice, or observing what they're saying and getting feedback from service users. People that use services can tell us how we are, can tell us all the time how we're doing. I hope that answers the question, but it's a big question.
Thank you. Thank you, Jacqui. Unfortunately, we've kind of reached the kind of end point for this panel discussion. Thank you all for the questions that you've posed. I'll ask the panel members following the session if there's particular questions that they are able to answer. Then obviously that can be managed through the Q&A process. So I'll wrap that up and hand you over to Ella.
Great, thank you so much, everyone. Thanks so much, Cherie, for chairing, and to LaReo, Renée, Jacqui and Karen for your contributions. And really huge thank you to the 300 people that we've brought together today for your questions and your comments, and for helping us put on such a rich discussion of the issues that we've been looking at this morning.